Hey YouTube, and thanks once again for tuning into our show, Morgellons Disease Discussion and Microscopy Videos. I'm your host, Jeremy Murphy, and today we are extremely fortunate to have joining us author of Lyme, How Medical Codes Mortally Wound Corruption and Scientific Fraud, author Jenna Luché-Thayer. Hey Jenna, how are you doing this morning?
I'm fine, thank you, Jeremy. Thanks for the opportunity to be here today.
And it's always good to have you on because we can have an in-depth and real conversation about Lyme disease. So to start things off, how have things improved, and have they improved since your book was published? And if anything, how are they worse?
Well, they have both improved and certain things are maintaining status quo. With regards to maintaining status quo, as you know, the Infectious Diseases Society of America came out with their draft of the new Lyme treatment guidelines, and they have basically made no attempt to change the guidelines according to science, evidence-based medicine. So Lyme patients, if these guidelines go forward, they're basically the same restrictive guidelines that will deny necessary medical care and necessary medical treatment for millions of people across the globe. So in that way, clearly, the Infectious Disease Society of America, IDSA, has no interest whatsoever in generating guidelines that are evidence-based. I say this because they are named in a federal lawsuit. Members of the 2006 guidelines are named in a federal lawsuit. And they have been shown they're alleged to be colluding with insurance companies to deny medical care for the Lyme patient community. Recent news, which is very, very good, is that of the major insurance companies that have been in collusion with the IDSA guideline authors, one has already settled.
Wow.
The rest, that's Kaiser that has settled. That's major news because the same facts stand for the Kaiser settlement as stand for the other insurers.
So just to clarify and to kind of simplify, some of the authors of the IDSA guidelines are involved in a lawsuit over if these treatment guidelines are causing patients to go without the kind of care that they need to treat their disease.
Well, they have been used to deny medical treatment. That's the problem.
Gotcha.
So this is not the recent version of the guidelines, but the recent version of the guidelines are almost identical to the 2006. So it's the same issues will stand. And the IDSA members that were part of the 2006 who are named in the lawsuit include Gary Wormser, Eugene Shapiro, Robert Nadelman, Alan Steer, Raymond Datweiler, John Halperin, and Leonard Siegel. And it's very interesting to note that within 6 months of the 2006 guidelines coming out, Raymond Datweiler had a patent issued that described Lyme disease as hard to treat. Often the illness continues after short-term treatment and is a very serious and deadly disease. So his patent language completely counter the language that they used to describe Lyme disease in the 2006 guidelines. And the way in which they're continuing to describe it misrepresent the illness.
Now, the 2006 guidelines were actually a rehash of earlier guidelines, right? They were basically
Correct. But what we need to know is that up until the 1990s, chronic Lyme disease was recognized and being treated extensively with multiple rounds of antibiotics, and it was being treated according to symptoms. And insurance companies basically took a decision in the 1990s to stop covering the care of chronic Lyme disease. And we have documentation that proves this. It's in the book by Pamela Weintraub, investigative reporter, in her book Cure Unknown.
Yeah.
Internal memos from insurance companies deciding not to cover treatment for chronic Lyme because it was costly. And in order to deny care, they had to come up with some quote unquote scientific and medical reasons not to treat it. And that's when the collusion began with members of the Infectious Disease Society of America to deny the nature of the illness.
Now, Kaiser Permanente, that was one of the insurance companies that was involved in what we're talking about today.
That's correct. And the other insurance companies are Blue Cross and Blue Shield, Anthem, wow. Blue Cross and Blue Shield of Texas, Aetna, Cigna Corporation, United Healthcare Services, and United Health.
That's just about all of them, isn't it?
Yeah, all the big ones. Yeah, sure. I mean, they took a decision basically not to cover a serious illness because it would save them money, at least in the short term. In the short term.
Yeah. So basically, the kind of care that a patient is afforded when they present with evidence of Lyme disease is a short round of antibiotics, maybe 3 weeks, maybe a singular.
Yeah.
And then after that, the insurance will not cover any further treatment for persistent debilitation?
Well, general guidelines say it's not necessary.
Oh.
And in fact, I mean, they will give a second round of antibiotics to sometimes if there's neuroborreliosis that's been proven or documented or whatever, but it's generally a denial of any antibiotics after the first treatment round.
And neuroborreliosis is when the infection is in the brain, and
yes.
Does that require IV antibiotics or?
I'm sorry. Yes, it does.
You're all good, my friend. I'm going to do some orange juice too.
I don't know where this is coming from.
Get this phone out of here. All right.
But yes, and even for neuroborreliosis, they don't provide the option for extended treatment.
Oh man.
So basically, the treatment protocol that insurance companies have gotten away with, and that has been promoted by the IDSA, is simply treatment for early acute infection. So if you catch it immediately and get it treated, a month of antibiotics should work to knock the infection out. But so many people do not meet that profile. They have gone undiagnosed. They have late disseminated Lyme. And these patients, which are increasing in numbers every day by hundreds every day in this country alone, are having, disseminated later stage Lyme is not adequately treated with a short round of antibiotics. The disease, the pathogen mutates continuously. It evades the immune system. It goes into various forms of infection that can evade antibiotics as well. So a short course of antibiotics does not work for later stage disseminated Lyme. And this is very well documented. And I want to talk about one of the big pluses that came out since my book was published. There was a major paper published. It's called The Long-Term Persistence of Borrelia burgdorferi Antigens and DNA in the Tissues of a Patient with Lyme Disease.
Dr. Sapie, huge.
Yes, Dr. Sapie is the primary author, but of course this Ken Legner is also one of the authors.
Oh yeah.
And this is based on Ken Legner's patient, Vicki Logan, who died from Lyme disease. And what they did was, this paper it's an incredible paper. And what they were able to do was take autopsy tissue, a tissue from her body, and they sent it to multiple labs in multiple parts of the country. And they did multiple different types of detection tests, and they all confirmed that she had active infection. That she had infection despite multiple rounds of antibiotics. And she ultimately died from the disease because they denied her treatment.
She was on antibiotics for 16 years, the paper says.
Excuse me?
I believe the paper says she was on antibiotics for over 16 years.
Yes, on and off. Yes. Yeah. But the point is, this paper is so critically important because not only did it prove persistent infection following multiple rounds of antibiotics, but it proved persistent infection by numerous techniques, histological and immunohistochemical methods. It's called IHC, conformal myocroscopy, fluorescent in situ hybridization called FISH, polymerized chain reaction, the PCR, whole genome sequencing, and metagenomics. And this was done by many different laboratories. So they didn't even, they used multiple laboratories and these all confirmed. And not only that, the authors on this paper include some very heavy hitters from very big mainstream institutions. So this was not a small group of, not well-known authors. These were some big heavy hitters using multiple institutions and multiple lab techniques proving persistent infection. And this is why the IDSA guidelines are so damaging, because this has been proven again and again that this infection can persist. I just want to compare Lyme disease briefly to another well-known vector-borne disease, and that's malaria. And when you live in a malaria endemic area, you will contract malaria eventually. You can do all kinds of things to protect yourself from the infection, but you will contract it. And what the public health response to malaria is to treat to the symptom. If you're symptomatic, you get treated. If you're not symptomatic, you don't get treated. Now, I grew up in malarial zones in Africa and Asia. I have shown to be positive for 5 different strains of malaria.
Wow.
I do not have an active case of malaria, but I have had active cases of malaria. And when I had an active case, when I was symptomatic, I was treated. And then, the treatment, the infection was under control, and I continued to carry malaria in my body because I continued to go into areas of the world that have malaria. I get exposed to it. I'm not constantly under treatment for malaria, but I am treated when I'm symptomatic. And it's very similar with Lyme disease. When you're symptomatic, you should be treated.
Oh.
You have an active infection. When it goes into remission, then okay, your body, you can take a rest from maybe active treatment. It depends on your body.
Yeah, because everybody carries infections. It's just whether or not their immune system is capable to handle the potentially damaging debilitation that people experience, or disfiguration that people experience. That's one of the reasons why Morgellons patients in particular are on continuous antibiotics, because their skin is continuously breaking out in ulcerations.
Right.
Well,
and so people need to be treated according to their symptoms. If their symptoms are active, then they need to be treated.
And malaria is a blood parasite, much like the tick vector disease, Babesia.
Yes.
These organisms, they crawl inside the red blood cell and eat it from the inside out, is what I understand.
Yes. And actually, I was born with congenital malaria.
Wow. So was your family also world travelers?
Yes. I was born in Vietnam.
Wow.
My parents were working with farming communities in between. My dad went over there right after the French Civil War and before the U.S. war in Vietnam, and was working with farming communities in rural areas. And my mother contracted malaria while she was pregnant, and I was born with malaria. And just the beginning of a long life of, for me, vector-borne illness. And I'm not unique. I mean, billions of people across the planet are exposed to vector-borne disease all the time,
Correct. And malaria comes from mosquitoes, just to be sure.
Yes.
Okay.
And congenital.
Yeah.
It was transmitted directly to me from my mother.
And we're going to talk about congenital Lyme in just a minute. The Kay Hagan Tick Act made the news recently.
Yes.
They're spending millions and millions of dollars on tick-borne infections. I saw the controversy, though, that the language of this resolution omits Lyme specifically. Is that correct? Is there any implications to not having that defined specifically?
Yeah, could I, you were asking me also what other things had happened that were important in terms of advancements in the advocacy field.
Yeah.
And I just wanted to mention, besides the lawsuit, which is very, very critically important, besides some major publications like the one I just described, also the European Union unanimously passed a resolution on Lyme disease. That means 28 countries in Europe unanimously passed a major resolution that recognizes that the Lyme patient community has been deliberately marginalized, that the diagnostic tests are of poor quality and insufficient quality.
Yeah.
That there has been a denial of a response to whistleblowers regarding the epidemic, that the threat of Lyme disease is a very serious and increasing public health threat, and something needs to be done about it. So that's a major resolution to have passed unanimously. So I want to just mention that because 28 countries in Europe unanimously passed this resolution regarding Lyme. It's a very different story than what has been done in the past regarding this disease.
Yeah, and most countries in Europe, I think, were holding a position that Lyme didn't exist in their regions. Is that correct? That was for most of the European Union.
Well, yes, and as I described in the book Lyme that you showed earlier, the policies around Lyme disease have been globally exported from the United States. So the policy has been basically to deny the depth and breadth of the epidemic in many different ways, as well as the seriousness of the illness.
When did that resolution pass?
November.
Wow, that's great.
Yeah.
So hopefully that'll
November. Yes. Yeah. So it's just a major. It's a major. I'm sorry, November 2018, not November 2019.
That's still pretty recent. Has that translated into better care for patients you've seen?
Well, this is a political resolution, so it still has to trickle down into public health policy state by state. But the fact that the EU elected representatives voted in this way is already a major sea change. Imagine if we had 26 states in our country vote this way. We haven't even had that at a federal level.
Yeah, it's not even on the radar in most states. Wow.
I mean, that shows huge political unity around a life-threatening pandemic.
Well, it's also a win for awareness and advocacy.
Absolutely. Absolutely. Yeah. But it does have to be followed up by, actual resources and changes in public health policy, so that things are done. And there's still a lot of resistance that is supported by, the IDSA, their colleagues, and the CDC and the NIH.
Oh. Well, what about Kay Hagan Tick Act?
Okay, yes. So the Kay Hagan Tick Act. Yeah, so the Kay Hagan Tick Act has potential. Of concern to me is that it used to have the word Lyme disease was mentioned in it 30 times, and it was deleted from every aspect of the act except for the title. So basically the act is going to support research, particularly to university settings, and assess gaps and unnecessary duplication, and develop a strategy that will assess gaps and unnecessary duplication in federally funded programs and activities related to surveillance, diagnosis, treatment, education, pathogenesis, and prevention of vector-borne diseases. So basically right now, What does this mean? It means that we have language that is going to support, in a general sense, attention to vector-borne diseases, including tick-borne diseases.
And mosquitoes.
Mention what? Excuse me.
And mosquitoes.
Yes, and because the language is so broad, in fact, all of the money could go for Zika.
Oh.
There's no requirement in this language that any of it go for Lyme disease.
Huh.
There's no requirement in the language that any specific portion of allocated resources goes toward tick-borne diseases or Lyme disease. There's no requirement in the language that the centers of excellence that they mean to establish will devote specific resources for Lyme disease. And of concern to me is that the centers of excellence are noted in the tick-borne disease working group report to Congress that came out in 2018. And in that report, they talk about chronic illness very generally and tick-borne disease very generally. Again, they make no specific mention or focus on Lyme disease.
Yeah.
So given that we have a long history of deliberate inattention to this epidemic, the looseness of the language is of concern to me. Now, this doesn't mean that the millions of dollars that are being allocated might not go to Lyme research to improve diagnostics and training, but there's no requirement that it does.
Yeah.
So without requirements, laws are only as good as written and as enforced. And right now, this law has a lot of vagueness in it, so it could be used in ways that do not serve this patient population.
What about the NHS? Are they supposed to kind of divvy up those funds and figure out which diseases are best to study?
Well, right now there's talk about having a national strategy, but the national strategy again does not specify anything. Tick-borne disease strategy, vector-borne strategy. These are national strategies. They have loose language. They don't say we're going to devote, 20% of the resources for Lyme disease, or for alpha-gal, or for Morgellons, or anything. They're not specific. They're going to try to coordinate with the tick-borne disease working group in HHS. They're talking about a lot of this is going to be better coordination and use of resources, but they don't specify prioritizing any particular disease, which is of concern. Yeah. Because Lyme has been consistently relegated to, no real priority.
Yeah, Morgellons is definitely not on their radar. That's kind of
right.
Yeah. For
yeah. Now, it could be that advocates can put pressure for monies to go in a certain way, but my knowledge and experience with legislation, of which I have quite a bit, and I wrote legislation on a number of topics that represented marginalized groups. And in my experience, you have to have very specific language. These come earmarking, where you basically set aside specific monies for a specific purpose. And federal agencies don't like earmarks, where they're told specifically, you spend this $20 million on this particular topic or this particular issue or this particular disease. They don't like that. They want to have their own decision-making process. But that was the way we would go about making sure that monies would go to the right people, meaning to the right people who should be served, those who should be served, and for the right reasons. So very specific language was very important. Otherwise, things would not be done. The other important thing was not only should the language be very specific in legislation, but also there should be specific measurements and commitments in the federal agencies of both the National Institutes of Health and the CDC for Lyme disease. For years, they have gotten away, the CDC has gotten away with basically establishing tick collecting centers as their only measurement for Lyme disease.
Huh.
They've had no requirement to advance anything in terms of hard metrics to be measured against. All they had to do was establish tick centers.
How do
they work? They just gave money to different universities, and those universities collected ticks. And then the CDC said, well, we've done what we said we would do regarding Lyme disease. So because these strategic plans that every federal agency has to write up, these are hard contracts with Congress, okay? And they have to meet the metrics that are specified in these strategic plans.
Are they?
And so if you have no metrics for Lyme disease, you don't have to meet them.
That makes sense. Is it somewhat ambiguous, the whole process, to garner more of a bipartisan support? Is there some kind of partisan difference in the way Lyme disease is viewed?
I think if there is bipartisan divide, it's more on who is responsible for paying for treatment.
Oh.
Because, there's a division over how healthcare needs will be served in this country. Are we obligated to provide healthcare services to all people?
Well,
can anybody be denied healthcare service? So some people feel that, you should work and pay for private insurance, and that's enough. It's an open market. Some people feel that the government has a role to provide services through Medicare and Medicaid, and maybe even a broadening Medicare and Medicaid to all as an option for healthcare service. So there is a divide on that in terms of who will pay and how medical care will be paid for. And that's not just for Lyme disease, that's for all illness.
Yeah.
So that's a bipartisan split. But in terms of recognizing the devastation of the disease, I would say that there are certainly elected officials in both the Republican and Democratic Party who recognize this is a very devastating illness.
Oh.
And that something needs to be done about it.
Yeah, because unlike most insurance covered situations, or Lyme disease is something that can really totally destroy wealth. I mean, and the capacity.
Absolutely.
So it would seem that maybe there would be an interest in ensuring that the patient doesn't become that people don't become a burden on society. With trying to battle the disease, that maybe there's an incentive to provide some kind of assistance so that the patient isn't taking everything on. Because in most regards, I believe patients are paying for their own illness, their own Lyme disease treatments, and working at the same time, sometimes 2 and 3 jobs.
Well, again, this disease, there's a lot of corruption around the disease, as I described in Lyme.
Yeah, oh yeah.
And there are a lot of predatory and opportunistic actors in the Lyme disease epidemic who are benefiting from offloading medical care, the cost of medical care, onto the Lyme patient and their family. Mm. So I describe how it's being done, why it's being done. But I mean, if you look at even the US government has been loath to recognize the seriousness of this illness because they have hundreds of thousands of federal employees who are at risk for Lyme disease and who are contracting Lyme disease.
Yeah.
They do not want the costs of these employees for the rest of their life. Yeah.
Oh, that's a great place.
They don't want to bear the financial costs of all of these employees who are contracting Lyme disease.
That's kind of what
financial burden. And so you have, what happens is you have, you talk about it, doesn't it make sense to provide medical care to people so that they can continue to be productive members of society. Of course it does. But governments operate in annual fiscal budgets. So if they can keep their budgets down on an annual basis, that's what they want. Kick the can down the road. Anything big that's going to increase an annual budget, they want to delay that. Number one. And number two, private insurance companies and pharmaceutical industry, they operate on a quarterly earnings. And so anything that can boost their profits on a quarterly basis, they will try to maintain and kick, again, not address something because they're trying to do quarterly earnings. And so you have a burgeoning population of this epidemic, and they've been trying basically successfully offloading all the costs onto that patient population. Bankrupting them, destroying their families, destroying their, it's a horrible human rights abuse of what's been done. Horrible human rights abuse. But I just hasten to say, it's not only Lyme disease that this is happening with. And to give you an example, the CDC did a report a couple of years back finding that there had been a significant increase in brain injury, long-term brain injury from concussions.
Yeah.
And that there had been a significant increase in the rate of concussions. And a lot of it was just due to sports. But these sports-related injuries were showing long-term medical costs and long-term medical considerations. So what they did was they redefined these traumatic brain injuries to post-concussion syndrome. And so if you can continue to have cognitive issues, severe headaches, migraines, other lack of function after a 6-month time period following a severe concussion, you're redesignated as psychosomatic.
Yeah, that's what I thought you were getting ready to say.
Yeah, and then once you're psychosomatic, you're put on palliative care, which is provided to people who are dying. Palliative care is just, some counseling, some pain management, some antidepressants. So this is the same thing they've done for Lyme patients. They've tried to, push us into a psychosomatic diagnosis to deny medical care and to put us on palliative care, make them only responsible for palliative care.
Yeah, that's exactly what happened with Morgellons patients.
Absolutely.
Yeah.
It's the same thing. Morgellons patients, that patient population has been systematically denied medical care.
Yes. It was Kaiser that worked with the CDC to develop the 2012 study. They selected patients who believed that they had fibers under their skin, but did not select solely a patient population who had observable fibers embedded in their skin. So that created a not a homogeneous patient population.
Well, they set the study up to make it all about a psychiatric problem as opposed to infections and medical issue.
Yeah, they really did.
Yeah, there was it's deliberately designed that way. They did the same thing with, chronic fatigue. I mean, famous case study.
Wasn't autism handled this way initially as well?
I don't really know enough about autism, the autism topic to speak on it. All I do know is that the CDC tried to bury a study showing that measles, mumps, rubella combined shot showed significant increase of autism outcomes.
Yes.
With the inoculation. And they tried to bury that study and they shredded it. But one of the scientists on that team for the CDC maintained records and turned them over to Representative Bill Posey of Florida. Yeah. And the findings were announced on the congressional and Senate floors. And he went into whistleblower protection, but we haven't heard anything else since.
Well, that's one of the reasons why Japan has split up the MMR shot. They don't even do the MMR. They do the measles, mumps, and rubella separately.
Yeah, 3 different vaccinations. Yeah.
Yeah.
It greatly reduces the chances of having an overwhelming immune response.
An adverse reaction. Yeah.
Adverse immune response action, yeah. Yeah.
So the Kay Hagan Tick Act, it's kind of up in the air what it's going to accomplish, but it's a little bit better than a resolution because there's money.
Yeah, no, definitely. I mean, it's going to provide money, but it's going to provide millions of dollars for vector-borne diseases.
Cool.
Which include tick-borne disease. But again, no specification as to Lyme disease whatsoever. And even no specification on the amount of resources that will go for tick-borne diseases. It could go all towards mosquito-borne disease.
These vector-borne diseases generally result in psychiatric conditions, psychological manifestations. So, but instead of treating the infection, the palliative care is administered for the conditions that result because of the infection. That's basically the.
No, it's different. I mean, what happens is a lot of people who have this infection, they develop a Lyme encephalopathy, inflammation of the brain, and that is tied. And with this inflammation, you can have a number of psychiatric complications because the brain is literally infected.
Yeah.
It's not working properly. It can cause anxiety, depression, OCD, obsessive compulsive, strange behavioral things that the person normally wouldn't have done because their brain is inflamed and diseased.
Yeah.
But what happens with the palliative care approach, which is what they've tried to dump Lyme patients into, chronic Lyme patients, is that they've said you don't even have a brain inflammation. You're just psychosomatic. You just think you're sick and you're not. So we're going to placate you and we're going to patronize you with dibbles and dabbles of drugs that do nothing whatsoever to address the underlying infection.
So, I'm sorry, I just got off track for a second there. Okay. Lyme disease is a corkscrew-shaped bacteria that literally drills holes into tissues. And so when you're talking about neuroborreliosis, you're talking about a condition where millions of little holes are being drilled straight into the gray matter. Is that right?
From what I understand, yes. I mean, I just to let everybody know, I'm not a medical and scientific expert, although I do have a science background as part of my academic training. But just from what I'm well read on the matter, but by no means an expert.
Sure.
But yes, my understanding is that this little spirochete corkscrews throughout all the organs in the body, including the brain.
And so the tests for the Lyme disease infection are not very sensitive. They're only testing for one particular strain of Borrelia. There's new tests on the way. What are your thoughts about these upcoming tests that they're getting ready to implement?
Well, the good thing is that the new tests are looking for more strains of Borrelia.
Oh, that's good.
And, so I'm not talking about anything coming out from the U.S. government. I'm talking about private laboratories have expanded, the range of testing to include different strains of Borrelia. The ongoing limitation for that type of testing is that it's based on your immune response. It's still serology based. So this means that your immune system has to recognize the pathogen and mount an antibody response against it. And that doesn't happen in all cases, and particularly for some reason, women less so than men. And or if you've had the infections for a long time, your body kind of just gives up and stops mounting an antibody response. But it's always good to have a more sensitive test. I personally had a DNA RNA test done that showed positive for Lyme disease. My antibody test was incomplete according to CDC standards. I had some bands that were positive, but I had clear evidence when I did a direct detection looking for the pathogen in my blood.
Wow.
So there's been a long debate as to why PCR tests, direct detection tests, are not used, and we have some incredible direct detection tests that Sin-Hang Lee, for example, developed the nested PCR, which is very sensitive. It's based on a Sanger method, which is worldwide accepted for all numbers of diseases. And the PCR test, the CDC recognizes PCR test results for over 72 different diseases.
Wow.
But for some reason, they say they won't recognize it for Lyme disease. It doesn't make any sense whatsoever.
Well, and it's hard to get access to non-standard tests. In South Carolina here, LabCorp won't test for Igenix Western blot. If you bring them one, they're not allowed to process it. That may have changed in the past 4 years, but it's different for different states which tests can be accessed, and also the awareness that the disease isn't just endemic to one region.
Yeah. Well, that's part of the game that they played, is to deny how widespread the epidemic is. Until recently, they denied that it even existed in Florida, which is absurd.
Yeah,
it's absurd. I mean, they just said we don't have Lyme disease in Florida. Well, one, we do, and it's been proven again and again. And number two, there are many people who live in Florida who are coming in from other parts of the world and other parts of the country, and they are coming with Lyme disease.
Yeah.
So, it's kind of like, we don't have cancer in Florida. Well, it's like, it's ridiculous. We have global movement and movement in the United States. Diseases are found everywhere. People are moving constantly. Lyme is just one of the many diseases that is moved around, and people move around with the illness as well as contracting it anywhere in the country.
Well, and Lyme disease, the earliest example was found in Italy. So that was from 2,500 years ago.
Right. It's been around for a long time.
Long time. And it's worldwide.
Yes, it's worldwide, and there's many different strains of it. That's the thing. But they may differ slightly, but they are pathogenic. They're disease causing.
Yeah, for example, the TBRF, tick-borne relapsing fever, has a slightly different presentation than the regular Borrelia burgdorferi disease. But those are starting to be. Igenix actually recently developed the TBRF test. Is that right? And New York was in the news for accepting that. Okay, approving that test. Gotcha.
Yeah, it's very important. Tick-borne relapsing fever is endemic to many parts of the country.
Wow, it's really bad in South America too.
It's found all over the world.
Wow. So the upcoming Lyme tests are giving us a little bit more hope for better diagnostics.
Yeah, I think, yes, absolutely.
That's great.
But they are serology based, which means they have their limitations. Direct detection tests have a very important place in this infection, determining whether or not you have this infection.
Yeah, now if you have Lyme disease, there's the potential that, like you said, over time, it can disable your learned immunity.
Yes.
So that your body isn't creating antibodies against it anymore, and you need those antibodies to register on a serology screen. So if the body's not creating them, then you may get a false negative saying, no, you don't have the Lyme disease, when in fact you got it so bad that your immune system don't work anymore.
Yes, and also for various biological reasons, women tend to stop producing antibodies.
Oh.
Partly because women's bodies are designed to have foreign objects in them, babies.
Yeah.
And we don't develop antibodies against babies. And so sometimes when there's a long-term presence, we stop developing antibodies. It's
Wow.
related to the.
And Dr. Bill Costerton hypothesized that up to 15% of fetuses harbor a pathogenic biofilm in utero.
Of Lyme disease or just pathogenic biofilm in general?
Just in general, just pathogenic biofilm in general.
I'm sure. I mean, we walk around this world and we have many different infections in our body, and we're exposed to many infections, and we carry biofilms of all kinds, but that does not mean that we are in a state of illness.
Right.
It's when our bodies become overwhelmed for various reasons that the illness takes off.
And that's really what the argument is about, is that people aren't seeking treatment because they think they have Lyme disease. They're seeking treatment because their hip is hurting so bad that they can't get out of bed for a couple days. And then the next day, their wrist starts hurting, or their face is breaking out in sores, or they have terrible night sweats. There's a lot of different conditions that do result from these spirochetal infections, which are historically regarded as a great imitator class of disease.
Absolutely.
Yeah. No, and it's congenitally transmitted. There has been several examples of Lyme being passed from mother to child in humans, historically in the research. Why did this become contested all of a sudden? Didn't you just get an ICD code developed for ICD-11 for congenital Lyme, and it got kicked out? What happened?
Yes. So in order to have an ICD code accepted, you have to submit a lot of scientific articles to show evidence of the condition. And so initially, when the World Health Organization announced its stable codes, meaning that the codes had all been vetted and these were stable codes going forward for the new ICD-11, there was an ICD primary code for congenital Lyme. Subsequently, now, the vetting process involves the invitations to participate to every nation in the world. And many nations participate in reviewing and vetting ICD codes. It's a multi-nation, multi-year, in-depth process because the codes are adopted by all the countries in the world. So there has to be agreement among nations and among governments that particularly primary codes will be accepted, because governments then track illness based on primary codes being registered. So let's say we had an Ebola outbreak. The primary code for Ebola is the same in the US as it is in West Africa, as it is in the Democratic Republic of Congo. And we all are using the same code. We can refer to it. We can see the description of the illness and details on what needs to be done. The same thing for the primary code for Lyme disease. And different diseases have multiple primary codes if there is a condition that is a complication of concern. For example, now Lyme disease has a primary code for Lyme carditis because it can kill you.
Yeah. Quick.
It has a primary code for Lyme neuroborreliosis because it can kill you.
Yeah.
You know, we have a broad primary code called Lyme disseminated specified, meaning now you can say you have a disseminated form of the disease. There's a primary code, and you can specify what part of your body is being attacked.
Oh, wow.
Is being infected. These are really important new codes. So we also had a code for congenital Lyme, and it was vetted and adopted. Then suddenly, right before the Christmas holidays, I got an alert that the code had been deleted. Now, it wasn't done in a transparent fashion because typically a code had to be voted up for deletion. In other words, it just has to be voted, like it has to be voted and vetted to get into the system. It has to be voted and vetted to be taken out of the system. And there are all these rules for transparency, and every nation should have a chance to make a comment on it.
Yeah.
Well, in this case, the Public Health Agency of Canada made a request to have the code deleted.
But that's not voted on.
No, It's completely wrong what was done. Now, the Public Health Agency of Canada was coming out with a paper that was co-authored with an official from the CDC, the US government, CDC, Centers for Disease Control, basically denying the seriousness and evidence of congenital Lyme. And that's why they wanted the code removed. And it's a very interesting paper because they provide actually ample detail in the paper showing that congenital Lyme is a very serious problem. And then their conclusions are that it's not a problem. So it's double talk and double speak.
Yeah.
But the reason that the US government and the Canadian government want to deny the seriousness of congenital Lyme and that congenital Lyme is a public health threat is because when you have a disease that is transmitted human to human, it requires a much different and much more expansive public health response than a disease that's simply vector-borne, where if you're bug repellent, you should be fine.
Wow. People would stop having babies.
Well, and you know, then you have to look into the possibility of if it's being congenitally transmitted, is there the possibility of sexual transmission? Should all pregnant women also, should they be tested for congenital Lyme? Should all newborn babies be tested for it in case the mother, should children who are in families where Lyme has been diagnosed, should they be tracked and followed to see if they in fact have the latent infection because it will affect their health? So it's a very different level of effort and response to an interhuman communicable disease versus simply an external vector-borne illness. It's a more costly public health response.
And it's more common than is being portrayed. People in general think that Lyme disease is very rare and endemic to a particular region in this country. But that's not the case when we're talking about Lyme disease and other Borrelia bacteria and other vector-borne infections. Well, if we just stick with Borrelia, that's still very common all across the world in every country, every state, every city, every town.
It's the most common vector-borne disease infection. In this country alone, it's the most common vector-borne infection, and it's the second most common infection after chlamydia.
Yeah, chlamydia is very common and not necessarily always sexually transmissible. There's an airborne.
Right, but my point is that's how it's so widespread. So there's been a very, very concerted effort to deny the breadth of the epidemic and to deny, you know, to say it's rare, to say it's, you know, uncommon, to say it's, and there's a lot of reasons for that. One, who's going to pay for it?
Yeah.
That's the biggest question. Who's going to pay for it? And then, of course, we have culpability on the part of the US government for the spread of tick-borne disease, because we have well-documented evidence that the US government has been playing with tick-borne pathogens and ticks themselves for biowarfare purposes. And as a recent book that came out by Chris Newby called Bitten,
great book.
You know, they were dropping tick bombs all over the country, not just in the Northeast. They were dropping them all over. You know, so they were, these diseases mutate, they interact. The ticks themselves became more resistant, tougher, able to survive in more environments. So there's culpability on the part of the government in terms of the spread of these tick-borne diseases, including Lyme. So there's a number of publications that have come out by well-established, reputable investigative journalists showing the role of the U.S. government in developing pathogenic tick-borne disease, and of course how these illnesses have escaped from time to time into the environment, causing disease clusters that then basically rippled out over time and space. Because once these pathogens get loose, these weaponized pathogens get loose, of course, you have all matter of migratory birds and wildlife and human travel transmitting it. For example, on Martha's Vineyard, you have many strains of European Borrelia found because it's a global tourist destination.
Yeah.
You know, we travel, we carry disease with us, which then the local ticks will bite, and that becomes then part of the local disease ecosystem. So,
and so when we talk about congenital transmission and 15% of placentas harboring biofilms, the pathogens that are inside the ticks, like the Lyme disease and babesiosis, they actually create the biofilms. The biofilms are comprised of those germs specifically, just to clarify for the audience who know what we're talking, so they know what we're talking about here. But essentially, to keep costs down, it seems there's been a effort to downplay the severity of the situation, and even to make people out who are going through it as kind of loony, as your book likes to point out.
well, it's a very well-known tactic to attack. If you don't want to if you want to delegitimize a disease, attack the people who are sick with it.
Yeah.
Discredit them as a group. Lyme disease is very interesting. I mean, there's been so many attacks against Lyme disease patients in different ways, different language. At one point, they were just saying they were neurotic, well-to-do housewives who had nothing better, because it was initially mothers who were coming forward in Connecticut, worrying about their kids. So they were neurotic, wealthy, bored housewives. And then, of course, attacks on celebrities who have been open about their infection and their disease, claiming that they're anti-science, even though there's no evidence whatsoever that they're anti-science. And then there are these ridiculous articles that have come out saying that there are unknown dark forces behind the chronic Lyme movement. And, and what's really appalling is that particular article was supported by a grant from the NIH.
No.
So the U.S. government has been financially supporting attacks on the character and nature of patients who are suffering from serious infection. That's a pretty hardcore, action. And I mean, that's very desperate and hardcore in terms of trying to discredit the disease and the patient population.
Now, is that a result of those attacks? Because these parents of children who are born with Lyme disease, they are being accused of fabricating their children's illness for attention, the Munchausen by proxy disorder.
Yes. Yeah. So Munchausen by proxy is one of the tools being used to deny the epidemic and to attack the patient population.
Yeah.
So the parents of children who have Lyme disease are basically, they're human rights defenders, and they are trying to do everything they can to get their children into care and provide care for their kids. And one of the tactics has been to claim that these parents have Munchausen by proxy. And Munchausen by proxy is a very rare mental health condition whereby a person harms the person that they are responsible for caring. So, you're harming somebody and then claiming that person is sick.
Yeah.
So it's actually a very rare condition, but for some reason, it's really exploded among the parents of children with Lyme disease. And, there's absolutely no, they actually had multiple hundreds and hundreds and hundreds of cases of this going on in Holland. School teachers and other people in the Dutch system were being told that if there are kids missing school, these parents probably have Munchausen.
Yeah.
They're actually being told deliberately misinformed. And doctors were being told that if a child presents with ongoing Lyme disease, that the parent probably has Munchausen by proxy. That's what they were being told. And they were being told this by a private, for-profit organization that's responsible for child welfare that gets money for every case that comes to them.
Now that's an AstroTurf.
Excuse me?
That's an AstroTurf operation.
Right. But what happens is they were getting money for every case they could come forward. They're being paid by the Dutch government to do the job. I mean, they're an intermediary organization that's subcontracted to do child welfare. They're a for-profit organization, and they're making money off of this. Anyway, the parents that were having this happen to, they organized and they brought a lawsuit, and they basically found that, it was all these Lyme parents with children who had Lyme disease, and it was all overturned. But they brought a legal suit against them.
Because this was about 450 parents,
families, yeah.
And every single one of them actually had serologic evidence of Lyme disease.
Yes. Well, I don't know all the details, but I do know they had sufficient evidence of Lyme disease.
Right.
But they proved that they had been singled out and they were being attacked for this false claim of Munchausen by proxy.
So, but this was a private organization working with the government to facilitate this. Okay, I understand.
Well, the thing is that what people have to understand is that a lot of what's considered government functions are actually subcontracted out to private institutions.
Yeah.
Okay. Same in Europe. So Holland, even though they have a national health system, it's being managed by intermediaries that are private insurance companies.
But they have to manage it the way that the government establishes the regulations to do so. But when they start to influence their own values into the system, that becomes what you call it, a fake grassroots kind of AstroTurf operation. When they're relying on their relationship with the government to establish a kind of authority, I think that people will take that a little bit more than just on face value. So I
would hope so, but first of all, a lot of times people don't realize that these are private entities. They think actually they're talking to a government representative.
Yeah, exactly.
And number two, the government could very well, in many cases, be telling these institutions to act in a certain way, but because it's not the government directly doing it, they, basically are shielding themselves from unethical behavior. Yeah. But they're still having their agenda carried out. So, we have this with the American Lyme Disease Foundation. Phil Baker.
Yeah.
And he just recently came out with an article claiming there's no such thing as chronic Lyme, persistent infection, and there's no need for ongoing treatment. The guy was a former government employee. Who knows where they get their money from? It's an AstroTurf organization. It's a mouthpiece for the same actors who are denying chronic Lyme, that include the CDC and the NIH.
So if someone in this country is in that situation where they're being accused of faking their child's disease, what steps should they take to protect themselves and their families?
Well, it becomes a legal matter.
Lawyer up.
And so it becomes a legal matter. Now, there was a recent case in Canada, and I helped provide documentation for that. And in that case, it was overturned because the institution that made the charge did not have the medical qualifications to know anything about Lyme disease.
Oh. Yeah,
There was no infectious disease specialist in that team who could claim whether or not the child had Lyme disease, and so they could not claim there was Munchausen by proxy.
Gotcha. And that's
so that was
that's a psychiatric diagnosis.
It is, but you can't deny one disease unless you have. I mean, you can, but if you have no qualifications to do so, that's how they overturned it.
Gotcha.
And then secondly, what's very interesting is the Public Health Agency of Canada posts both the ILADS, International Lyme and Associated Disease Lyme Treatment Guidelines, as well as IDSA guidelines. So both guidelines are up there on the Public Health Agency of Canada website.
No, that's like what you call it, a dichotomy. I don't.
Yes, but the point is that they're both listed, and so the message is that both have met evidence-based science criteria. Therefore, treating doctors have a choice.
Oh, okay, I got you.
They have a choice.
And so if
like I said, that case was one because the people who were claiming Munchausen by proxy did not have any of the credentials to claim the child did not have Lyme and other tick-borne diseases.
Wow.
And the person who reported the family had no right to make the report. The doctor was disciplined simply because he disagreed with the treatment approach, when the treatment approach came from guidelines that were posted on the Public Health Agency of Canada website.
That's what happened with Mary Ata. Was that her son was the first case of Morgellons on national TV, and she was accused of Munchausen by proxy by one of her doctors.
Is this the woman who had 3 children who were sick, and she's from Florida?
Yes.
The one who had like the first Morgellons Foundation?
That's right.
Yeah. At some point, I'd like to know where she is now today, but yeah, I remember reading about this years back. Yeah.
We definitely want to know she's safe and doing well.
Good. And she's a scientist.
Yes.
That was the thing I remember. She's a highly qualified scientist. Yes.
And I mean, the evidence is right there for anybody who wants to look at it. But that is
They have no trouble recognizing Morgellons type illness in animals.
That's true. Yeah.
It's well documented. And sorry for those of you out there who don't believe this, but humans actually are animals as well. we contract animal diseases.
Some of us more so than others, I think. Jenna, what is the brucellosis?
Yeah, so brucellosis is a bacteria called Brucella, and it's a zoonotic disease. It comes from animals to humans, and it comes also from tick bites. When the ticks bite infected animals and then they bite you, you can get it. You can also get it from poorly undercooked meat and unpasteurized milk.
Oh.
So I was serving as a Peace Corps volunteer in North Africa, and when I was having my exit physical to see my state of health before leaving the Peace Corps, they said, "Oh, you have brucellosis." And I was like, "Oh, is that bad?" And they looked at me and they go, "How do you feel?" I'm like, "I feel okay." And they were like, "Well, then you're fine." And I was never treated for it.
Wow.
I was just sent on my way. So, I mean, I was a young person. I already had contracted Lyme disease, by the way, and I already had multiple strains of malaria. Now I have talked to a microbiologist about that, and I had contracted tuberculosis as a toddler.
Oh man!
And at that time, they did not treat children of that age. They took me to the ocean and kept me in a sunny place, and it went into remission. But maybe the fact that I had tuberculosis as a child, as a toddler, helped confer some immunity to the brucellosis because they're similar. So the exposure, maybe that's why I didn't get so sick with it. But I still should have been treated.
Yeah. Well, because it's a pathogenic infection. It can actually cause damage.
Oh yeah, they can attack it attacks the heart, the joints, or different organs. There's proof that it can be sexually transmitted many times in animals. There's been some cases of sexual transmission between humans. So,
Wow.
I mean, my poor husband, we got married and he got really sick shortly after we got married. So I don't know.
Oh man.
I'm smiling. It's not funny. It's not funny, but
well, you were fortunate in that regards. And it's not all Lyme. I mean, there are other tick-borne infections that can be potentially very, very serious and just aren't well known about. I mean, brucellosis, that's something, honestly, I don't think I'd heard before I talked with you initially.
Well, it was a problem in this country before we pasteurized milk. That was the most common form of transmission, was unpasteurized milk, and also people who are handling meat, exposure to raw meats. So butchers, for example, are still at risk for it, but they tend to inoculate animals in this country against brucellosis, and in Europe, it used to be a much bigger public health threat. But I was living in North Africa in a rural community. Nothing was inoculated.
Oh,
Animals were healthy or they were sick.
Yeah.
I was drinking unpasteurized milk straight from a cow.
Holy wow.
Yeah. There was no supermarkets.
Huh.
I had to grow my own food. We had to grow our own food.
Man. Did you? Well, so they have a.
That's also how I grew up. That's also how I grew up in Asia and Africa.
Okay.
Just exposure directly, direct. We grew most of our own food, and we were not pasteurizing milk and such. You would just say, okay, the cow's healthy, you can drink the milk, kind of thing. If the cow is sick, don't drink the milk.
Right. That's a good way to look at it.
Yeah.
Well,
that's a developing country. It's in a developing country. That's typically how things are done,
That's in South Africa and in Vietnam?
No, I was in West Africa, Southeast Asia, also in East Africa.
Wow.
And then I know that I contracted the brucellosis in North Africa.
Man. But they have a vaccine for brucellosis?
Yes, yes. I mean, that's one of the things that they vaccinate animals against.
Okay.
As I recall, I believe so, yeah. I'm just saying it's not a major public health threat anymore in this country or in Europe. But in developing nations where you have very limited resources, there's not necessarily a lot of vaccinating going on for for livestock.
There was a story in the news a couple weeks ago about brucellosis. That's why I bring it up. And you had also mentioned that you experienced it yourself. So I wanted to get a little bit more of an idea of what it was all about. And I appreciate you informing me and our audience about that.
Yeah. And, I don't recall being sick at the time, but I had been sick. I had different illnesses while I was serving as a Peace Corps volunteer. And many of these illnesses, they basically start out with, you get fevers and body aches and chills and stuff. That could be any number of pathogens that are causing that.
Yep.
Quote unquote flu-like illness.
In
one case, I had very severe abdominal pains, and I made my way to the capital, which was a 2-day trip, by the way, and they found I had liver abscesses that had ruptured from amoeba infection.
Wow, an amoeba?
Yeah.
Where do you pick those up from?
Water.
I guess the lake and stuff. Yeah, that's
water. I was using well water.
Oh man. Yeah, those are nasty.
And I was told that the water was clean, that I didn't have to boil it. I was misinformed.
Yeah, amoebas eat other bacteria. They eat bacteria and viruses and stuff.
Yeah.
Craziness.
I've had amoeba multiple times.
They've been in the news recently for young girls picking them up swimming in lakes and stuff. The brain-eating amoebas. Yeah.
Yeah,
Wow.
I've had them multiple times. When you live and work in developing countries, which I did much of my professional life as well as growing up, you get exposed to amoeba because even if you practice very good hygiene, the chances of you at some point coming across contaminated water is still high.
They don't process their water like we do here.
No, and even if you boil the water before you drink it, that doesn't mean you're not going to get a wet plate that has dirty water on it. In other words, somebody's washed a plate, but it has an amoeba on the water in the plate or something. So
yeah,
it's hard to avoid certain infections. You avoid them as much as possible, but that's why it's so important to recognize that certain infections are endemic, and when you show symptoms, you should be diagnosed and treated.
Correct. Yeah, some infections are endemic to particular regions.
Right.
But Lyme disease is pandemic. It's all over the world.
Okay. Lyme, moving away from Burgdorferi version, but Lyme-like illness and relapsing fever, borreliosis, pathogenic borreliosis is global.
Yeah, correct. Well, how did you end up with Lyme disease?
Well, I've been exposed to multiple tick bites in multiple times in multiple countries.
Wow.
So I was diagnosed positive with a PCR test for Burgdorferi, but there's every indication I have relapsing fever borreliosis as well.
Yeah.
I was never told to be concerned or treated when I got tick bites. And I do know that when I was 16, I don't remember getting a tick bite then, but I developed a partial Bell's palsy on the right side of my face, and I had severe joint pain and severe fatigue for a period of 3 months, and then it resolved. I mean, so bad that I couldn't get out of bed, kind of thing. And I was 16 years old, and I was an athlete and very healthy young woman. So at that time, I became basically bedridden for 3 months with a palsy, and then it resolved. And I think, it was one of those things where my immune system was still young and robust enough, I was able to knock it back. And then when I was 19, I started getting just severe fatigue again and severe light sensitivity. But then I ended up having an injury that put me in intensive care for 6 weeks and major surgery. And so I was on antibiotics for an extended period of time. And so I think at that time, the infection was again knocked back because I was being treated for another purpose with very high levels of antibiotics. So my body has had this for decades, and I was diagnosed at 52.
Oh, wow.
Yeah. And I developed ongoing, more complicated health issues starting my mid-30s. And by the time I was 43, 45, I was very, very sick. Sleeping 16 hours a day kind of illness. Yeah. Terrible pain. Misdiagnosed with lupus, misdiagnosed with multiple sclerosis, misdiagnosed with 4 different autoimmune diseases, told that I may have unresolved issues. I remember my knees were very, very swollen. And even though I felt terrible, I would get out and try to exercise every day because I felt that if I didn't exercise, my whole body would just shut down. And I was in terrible pain, but I would walk or swim every day, and my knees were all swollen up, classic Lyme knee. And the doctor said I was walking too much, which is why I had swollen knees.
Oh.
And I was in my 40s, you know. I mean, just incredible amount of misinformation, disinformation. I don't think these doctors were deliberately trying to deny that I had Lyme disease. I think they've just been completely misinformed.
Yeah.
Completely misinformed.
Yeah.
Not one of them, I mean, not one of them talked to me about lifestyle and if I'd ever had exposure to any, tick bites or anything. No, not one.
Dang.
And the thing is, I've known about Lyme disease since the 80s because I actually know people who were very sick with it in the 80s. And I knew it could be very serious, but I was misinformed too. I thought you needed a bullseye rash. I've never shown a bullseye rash.
Right.
I remember saying to myself, I'm so lucky, even though I've gotten bitten by a bunch of ticks, I've never contracted Lyme disease because I've never had a bullseye rash.
Right, exactly. Same here. So for actually, growing up, I was bit by a lot of ticks. I did experience Lyme debilitation throughout my early life, but in my 30s, mid to late 30s, I developed a bullseye rash, but I didn't see a tick, so I didn't think that it could be the potentially Lyme disease. Now, but growing up, your childhood was a little bit different than mine in that you weren't constantly being rotated on antibiotics and steroids.
No, I was actually very, very few antibiotics ever growing up. I had all the childhood diseases. I was not vaccinated against them. My parents were living in places where they didn't have access to vaccines. I got vaccinated for polio as a young adult, for example. So it wasn't until I was an adult and in the United States that I started getting really any exposure to antibiotics. They just didn't happen where I was living.
Yeah.
They did. I mean, I think occasionally, very occasionally, there were we were treated with antibiotics. But developing countries are known for, medical shortages. And we were not living typically in capital cities. We were living in rural areas, working with farming communities. So I think as a teen, we were put on prophylaxis to try to prevent malaria, but very little exposure, and certainly never any steroids. And when I was misdiagnosed with multiple sclerosis and lupus, well, of course, they wanted to put me on steroids and biologics, immunosuppressant drugs. And because of my science training, I said, I do not agree with your diagnosis. It does not account for all the things that are going on with me.
Right.
It only corresponds with a fraction of the symptoms that I have. And so I knew that the drugs were immunosuppressant, and I did not want to go on immunosuppressant drugs. So I never did any of those treatments that were recommended.
Yeah, and that's potentially one of the factors in persistent debilitation is the patient history, how often they've been put on these short terms of antibiotics and steroids and immunosuppressants. And that's really just the case with, especially in places that are not considered endemic, is people get on that gamut of antibiotics and steroids, and then they end up later in life with real debilitation and serious antibiotic resistance. So that's good, and I think it accounts for why potentially you had a speedier recovery earlier in life was because you were able to abstain from being exposed to all those short courses of antibiotics and immunosuppressants. Potentially, maybe. I'd like to look at that a little bit more.
And also my body my immune system was trained from a very early age to fight off a lot of different infections.
Right. You had a lot of...
I had exposure to malaria. I was born with malaria. I survived that. I contracted measles, mumps, chickenpox, survived those. I had tuberculosis, survived that. I had amoeba infection, survived that. I had exposure to typhoid. I had exposure to cholera. dengue fever, So, there's a reason why many children in developing countries do not live beyond the age of 5 years old.
Wow.
Very high mortality rate for children under 5. But if you're in a family like I was, where, I was given good nutrition, and when I was sick, for example, when we had spiking fevers, we weren't given antibiotics, but we were put in ice baths.
Yeah, Russians do that also. They put their kids out in the snow. Maybe not anymore, but I've seen pictures of that where they have daycares of entire, just like 10 kids out in the snow wrapped up, building up their immune systems. I don't know if that's effective way to do it or not.
I don't know either, but I'm just saying when we got spiking fevers, they would put us in an ice bath,
That's awesome.
to bring down the fever.
Real quick too, huh?
Yeah.
Well, so how did this convert into you actually working with the World Health Organization on the ICD codes?
Well, so and I had this life of growing up internationally. I ended up working professionally internationally for both the U.S. government, for the Agency for International Development, as an advisor to them on the rights of marginalized groups, particularly women and children, and also to bring services to women and children, medical services, education opportunities, economic opportunities, etc. And then I went over as a senior advisor also to the United Nations, where I was doing similar work globally. So I was covering the world on basically helping the most marginalized people have access to basic services.
Oh.
So access to healthcare, access to educational opportunities, access to economic opportunity, having a political voice, being politically represented, making sure that services at the local level, local government level, were being delivered in good quality and good time, and that there was citizen participation in the quality and delivery of these services. So that was like my general area of expertise. On the flip side, I was dealing with a lot of corruption issues that we're trying to work around, form systems of transparency and accountability, working in systems where there's intense discrimination against certain groups or individuals, types of individuals, trying to overcome historic, cultural, and other reasons for these forms of discrimination that ended up creating obstacles to services for certain groups. So I was doing this over multiple decades, and then I became too ill to work full time. And then I was diagnosed with Lyme disease, and I started reading everything I could about Lyme disease. I couldn't figure out how is it that a disease I've known about since the early 80s and then get diagnosed with. And, now it's, let's see, 52, that was 2012 I was diagnosed.
Wow. It's been around since the 80s.
Yeah. I've known about Lyme disease since the 80s. So, and it was on the CDC website since the 80s. So I am, or maybe even earlier, but certainly by the early 80s. So that period of time, never once did it come up that I might have Lyme disease. I'm like, how did this happen? How could it possibly happen that so many years went by without not one inquiry into this possibility? And then I started reading everything I could about this, and I said, wow, this is a situation of human rights abuse and corruption. This is why people are being denied care. This is why this patient population is being demonized, vilified, and marginalized.
Wow.
I mean, this is a time. So I basically brought to bear all of my professional expertise in these fields where, I had been advising governments across the world on how to do things better.
Yeah.
And I was looking for an avenue, place where I could go forward, working internationally to make a change. And this is where, through conversations with Dr. Ken Legner, we discovered the opportunity to change the ICD codes.
Nice.
So he was complaining about the lack of codes, the medical codes, and these drop-down medical advisory systems that doctors use that are linked to codes, and how how paltry, how insufficient the information and the coding and description of Lyme was. And I was like, oh, I know what to do about this, because this is part of the UN system, the World Health Organization. They're responsible for developing the codes with multiple countries, and I can go in through that process, and we can hopefully try to affect change. Because I knew from what I could read that it was not going to happen by providing medical and scientific information to the CDC or the IDSA or the NIH. Clear evidence that those efforts had not resulted in much at all.
So the ICD codes are actually pretty powerful.
They are. They're very, very powerful. When you have an ICD code, you have a chance for having your disease recognized. There's a much higher chance it'll be recognized because there's a code that will drop into your doctor's medical drop-down system saying, you put in these symptoms, oh, it could be this. Here's the ICD code. And then that ICD code is tied directly to coverage and reimbursement of care.
So it actually will guide the physician into making a diagnosis.
Yes, it can help guide. Yes.
Wow.
If there's no code, the chances for finding a diagnosis is much higher.
Gotcha.
For example, there was no code for Lyme carditis. Now we have a code for Lyme carditis. That means people who didn't even know about Lyme carditis will see it's a possibility.
And the CDC recently issued a warning about Lyme carditis to people who are suspected of having it to start antibiotics immediately. That was just a couple weeks ago.
Yes, then they're talking out both sides of their mouth, because on the one hand they're saying start antibiotics immediately, and on the other hand they're saying, however, you're testing negative on the ELISA test, so no need for treatment.
Well, didn't they say that the field criteria, including the standard immunosorbent enzyme-linked assay? Wow, I can't believe I just said all that.
ELISA, yeah.
It's not necessary for a diagnosis, but the CDC claiming now that a clinical diagnosis is all that's necessary?
What happens is they have softened some verbiage, but ultimately insurance companies have to cover these costs.
Oh.
So if an insurance company says you tested negative on the ELISA test, and they can refer to the CDC videos and documentation saying the ELISA test is very good,
yeah,
then they can deny treatment, coverage for treatment.
Man.
So that's why I'm saying they're playing games.
Gotcha.
You know.
And it's really not.
The insurance companies are able to cherry pick, all of this verbiage from the CDC that supports no treatment unless you test positive.
Okay. So kind of like a backdoor way out.
It's not even a backdoor. I mean, it's the CDC, until the CDC says immediately treat despite positive, negative tests. They're not saying despite negative tests. They need to say that.
Yeah, gotcha. That needs to be specified directly.
Yes.
Well, and especially at least until the new tests come out. I mean, assuming that they're going to be any better.
Well, the new tests, like I said, they're going to be an improvement, but they're not sufficient. You need to have direct detection tests. Why does the CDC recognize direct detection tests for 72 infections?
Yeah, and they
denies direct detection tests for the validity of direct detection tests for Lyme. The other thing is the NIH said back in 2001 that they had a direct detection test ready to roll out for diagnosis of Lyme disease, and they shelved it.
That was in 1991?
2001.
2001. And
yes.
Dr. Shapey's group developed the new culture method in 2013, 2014. The CDC issued an advisory not to use the new culture method. They said that it was too easy for the samples to become contaminated.
Cross-contaminated, yeah.
Yeah. So we have direct detection,
Denial of the epidemic.
but no way to access them in mass. What about over in Asia? Is Lyme disease over there?
Yes, it is. And in fact, it's interesting. Some of the World Health Organization publications talk about Lyme disease and how it's endemic throughout Asia, including Mongolia.
Wow.
Yeah, and they have strains of it certainly in China. That's been well documented. They have another strain of Lyme-like illness. It's not Burgdorferi, but another Borrelia pathogenic one in Japan. That's well documented.
Right.
So yes, it's a problem. I do not know enough about whether or not people are being tested for it and being diagnosed and treated for it. I do not know. You know, a lot of these things are political decisions on what's going to be recognized and treated. So I do know that they recognize it. I do know that there's been quite a few publications coming out recently from China discussing, you know, a number of very serious tick-borne diseases in general. Like they're starting to recognize there's a big tick-borne disease burden on the population, and there's some very bad ones. But I do not know exactly where Lyme disease fits in there in terms of, you know, prioritizing by the government. But I do know it's recognized.
Yeah, I saw something in the news recently about China addressing specifically the Lyme problem they were having over there.
Yeah, I'm sure the thing is the Chinese government has a history of being very practical.
Yeah.
And so if things start to affect their economy and productivity, they will tend to address it.
Gotcha. And having a bunch of sick, debilitated people not able to be productive is going to impact the economy in a negative way, right?
Yes, it will.
I'm no
And
economic.
as a matter of fact, I mean, it's considered back in the 90s, there was a congressional inquiry initiated to the military to determine the impact of Lyme disease on military and military families because it was considered a national security threat.
Wow. Back in the 90s?
Back in the 90s.
Man, a lot of good stuff.
And guess what happened with that report?
I guess it disappeared.
Buried.
Oh, man. Yeah, I'd love to see what came out of that. Besides nothing. ILADS got together and put together new case definitions for chronic Lyme disease. What do you think about it?
It's a fantastic paper.
Wow.
So necessary. So necessary. So basically, they acknowledged that chronic Lyme had been poorly defined, and it needed a tight definition if they were going to speak to it, particularly in response to the fact that it's been very misrepresented as like a vague kind of fatigue maybe and a little bit of joint pain, very downplayed by the IDSA and their authors and groups. So they defined it as a multi-system illness with a wide range of symptoms or signs that are either continuously or intermittently present for a minimum of 6 months.
Oh, nice.
Yeah. And then they state very emphatically, the illness is a result of an active and ongoing infection.
Right.
By any of several pathogenic members of Borrelia burgdorferi sensu-lato complex. And they describe it as the infection has variable latency and periods and symptoms and signs that wax and wane, they come and go, and they migrate. So they then stated that there's 2 forms of chronic Lyme disease. One is untreated and one is previously treated.
Oh.
Yes. So they did a very thorough job. They did a systematic review of over 250 peer-reviewed papers in international literature to characterize the clinical spectrum of chronic Lyme disease. Anyway, so they're hoping that the use of this definition will promote better understanding of the infection and facilitate future research.
Okay,
So it's a very, very important paper.
there's the IDSA case definition of Lyme disease, and now we have the ILADS case definition for chronic Lyme disease.
Right. The IDSA describes acute early infection, does not describe the long-term chronic disseminated persistent infection.
Oh, okay. And so if a physician...
They refer to post-treatment Lyme disease syndrome, the IDSA, which of course is a fake syndrome that doesn't exist, and it's used by insurance companies to deny care. They say you are post-treatment, meaning you need no more treatment.
Yeah, post-treatment Lyme disease syndrome states that the patient's illness is most likely, I want to say it states most likely or definitively that it's psychosomatic in nature because there is no active infection. What they're really stating is there's no active infection, though.
There's no proof of active infection.
And that's because the antibody test is not able to pick up antibodies that aren't being made.
No, they just made that up. There was no, the whole syndrome was completely fabricated. There's no scientific evidence of post-treatment Lyme disease syndrome.
Yeah.
It does not have an ICD code. It's a fabricated syndrome. It's a way to deny the nature of the illness.
Is it still up to the physician if that's the diagnosis a patient gets over chronic Lyme disease?
This is a maneuvering. This terminology has been promoted. There's no such thing as post-treatment Lyme disease syndrome. So but having a document that proves and defines chronic Lyme disease is an evidence-based article.
Yeah.
And definition. Whereas post-treatment Lyme disease syndrome, they clearly say we don't know what causes this.
I guess my question is a physician at risk of administrative, losing their license if they diagnose someone with chronic Lyme disease under these new guidelines?
I don't know. I don't know what's going to happen there. It's too early to tell. I think that this federal lawsuit in Texas will go a long way to protecting physicians.
Gotcha. Okay. We'll just wait and see how that turns out.
Yeah, well, like I said, Kaiser's already settled, and the same information stands for all of the other lawsuits, for all the other insurance companies and the IDSA and their collusion.
That's great news that they settled. There's some kind of action on that case.
Yes.
Good deal. And they're getting ready to meet again in February, I believe, that court case. I think I saw something.
I think it's February, yeah.
So what about Morgellons? Is it starting to become more accepted? Did you get a chance to see Skin Deep?
Yeah, so I was going to say, I mean, Under Our Skin had huge global impact in terms of raising awareness and understanding of the nature of the disease of Lyme disease. Yeah. And I do believe that Skin Deep, the movie Skin Deep, which is Skin Deep, the Battle Over Morgellons, that was put together by Pi Ware, who was an Emmy-winning filmmaker, has the same potential. I mean, because a lot of people will watch this movie, and that will help to spread awareness and legitimize the illness, that's been so poorly represented by mainstream media and by corrupted medical institutions and individuals. So that's a very, very important contribution to global health, is that movie, Skin Deep. And of course, another very important global contribution is the book by Ginger Saverly, practitioner Ginger Saverly, called Morgellons, the legitimization of a disease, a factual guide by the world's leading clinical expert, correct? Yeah, that's a very important contribution to global health. And then, of course, the multiple papers that have come out, research papers and such that include work by Marianne Middlebeen.
Oh, yeah.
And Stricker. So, anytime we can get publications out, books written, and movies, to highlight and inform the public because it's going to be basically public information and public pressure that will overturn corrupt medical practices.
Gotcha.
And corrupt insurance practices. Because this corruption has become wide, according to the Special Rapporteur, United Nations Special Rapporteur for Health Human Rights. They did a 2016 study comparing the global health sector to other economic sectors, for example, tourism, logging, retail, extractive minerals, whatever, all the different economic sectors. Yeah. And conclusively, the global health sector is the most corrupted sector globally.
Yeah, that's kind of.
It is the most corrupted sector globally. So Lyme disease and Morgellons, these are like poster children for this corruption, right?
Oh yeah.
But they're certainly not the only evidence of this corruption. There's evidence every day. You have to just look at the news of how this corruption is played out. And in the United States, we have actually legislated corruption.
Oh yeah. People, we spend more money in this country on healthcare than anywhere else in the world, and yet we have the sickest population.
Of developing industrialized nations, yes, we have low health indicators. Yeah.
A lot of that too is this true in your opinion that people just aren't really aware of how healthy they can be? They often mistake illness for personality.
It's a very big question and it's very complicated.
Thank you.
But, the biggest money makers for pharma are symptom modifying drugs.
Yes.
So medical schools are training doctors not even to diagnose, just to treat symptoms. So when you do that, you're going to have a sick population. If you're not getting to the underlying cause for illness and treating that and doing something about that, if you're only treating symptoms, then of course there's going to be a burden of disease upon that person because there will be no attempt to address the underlying cause of illness.
Yeah, to even
identify it. And I'll give you a personal example. So when you work and travel in developing countries, you get exposed to a lot of bacterial infections, including many that affect the gastrointestinal system, like amoeba. I've told you I've had amoeba a number of times. Anyway, so I came back from one of my trips and I had gastrointestinal distress. And I went to the doctor and I described what I had. And I said, would you please test me for Giardia, which is another one, amoeba, et cetera, et cetera. I've probably had exposure. I was working in village, level farming communities. I was probably exposed to these pathogens. Would you please test me for these pathogens so I can get treated?
Yeah.
The doctor told me you probably have IBS. I said, what's IBS? Irritable bowel syndrome.
No.
And he said, why don't you come back in 3 months and we'll see how you're doing.
Oh, no.
Yeah.
Yeah, because if you've got the Helicobacter pylori, that's just going to eat holes in your intestines.
Yeah, so I said, you want me to come back in 3 months and see how I'm doing? I said, why don't you just test me for these pathogens?
Yes.
Well, we'll just see how you're doing in a few months if you're still having complaints. Meanwhile, you can take these drugs for IBS. And I said, if my bowels are irritated, it's because I have pathogens in them.
Why is that general practitioners are so afraid to deal with potentially infectious? Is that because they usually have to pass it
They're
off?
being trained, and they're being trained to treat symptoms. They're being trained to look at everything as syndromes. They're being incentivized to distribute certain drugs and incentivized to make certain diagnoses. Financial incentives, they're like, not all, certainly there are good physicians out there, but there's a lot of pressure to operate in this way. And in my case, I contacted a semi-retired tropical medicine specialist and I said, listen, I think I've had exposure to such and such. Will you please test me? They did, and that's what I had, and I got treated and I was fine.
Man.
But otherwise, I would have joined the millions upon millions of Americans who believe they have irritable bowel syndrome.
Yeah.
And are taking drugs every day to control what probably is the result of active infection.
That happens a lot with acid reflux also. People may just actually have low stomach acid and are resulting in low indigestion.
Well, I'm just giving you an example, of I mean, how is it that suddenly everybody had irritable bowel syndrome?
Yeah. The
It's ridiculous.
autoimmune disorders, I think, is something we ought to look at. I mean, I do understand that pathogenic infections can result in autoimmune responses, but
Sure.
to suggest that the body's attacking itself for no reason whatsoever when it hasn't ever previously in history. I mean, and this is because these antibody tests aren't revealing antibodies. Not necessarily that's just one reason, but not necessarily that the body isn't under attack from various infections, some latent.
Yes.
What's good and what is bad about Disulfiram?
Okay. So I just noticed we've been speaking for almost 2 hours. So
Hey, thank you for giving us so much time today, too. You're great.
no, I'm very happy to do this. I just hope that people will have time to review the whole video because it's a big, long video.
Yeah.
But anyway, so what is good and bad about disulfiram? So for me, one of the big improvements or big breakthroughs in this last year was disulfiram. And both my husband and I have tick-borne diseases. We both have Lyme disease. My husband is from Lyme, Old Lyme, Connecticut.
Yeah.
And he's been infected with this illness since he was a teenager easily. He remembers having a quote-unquote summer flu that nobody else seemed to have. And on and off health issues, but really accelerated in his late 40s. And was diagnosed at the age of 55 rather. He was diagnosed at 55.
Okay.
And did not respond as well as I did to treatment. You know, I was actually far more ill than he was when we got diagnosed, but I responded much better to treatment and got better. Whereas his health kind of is up and down, and really over time just getting worse and worse. And he's, he had been diagnosed with Bartonella and Babesia, so was I, and treated for these and treated multiple rounds of antibiotics but anyway, this last over a year ago, he was getting to the point where it looked as though he might have to see about going on disability.
Yeah.
He was that sick. And I had heard from Ken Legner that he was trialing a drug called disulfiram that had showed to be promising in test tube to kill this pathogen, very promising. And he was already testing it on a couple of patients, and they were starting to show good results. Now, his paper had not come out yet, but he was pretty excited about this. And Ken's a good friend of mine, so I wanted to find a doctor who would treat us, and we found another doctor who was willing to treat. And both my husband and I went on disulfiram, and my husband went from basically disabled to fully functioning and taking up activities he had not done in years.
Wow.
I mean, miraculous recovery. Now, is it a cure? We're not claiming that, but was it very effective in knocking back his infection and giving him good quality of life? Oh, Kira.
Hey,
This is my Kira, you're coming to say hi?
Hey.
This is Kira.
Oh, wow.
Kira, hi. You can say hi, Kira. Anyway. Hi, Kira. Anyway. So he went from barely being able to get out of bed to kayaking.
How long did that process take on the disulfiram?
He did almost 12 weeks, just short of 12 weeks. He got up to 500 milligrams a day. He's a big guy.
Yeah.
He started lower and he pulsed it for a while on and off, and then built up slowly to 500 milligrams a day and stayed up that almost to 12 weeks.
Wow.
And like I said, just remarkable improvement. And he's now been off the treatment for, let's see, nine months with no relapse.
Congratulations. Great to hear.
Holding great.
Wow.
No sign of relapse at all.
Is this an expensive medication?
No, it's a generic drug. It's recognized as being broadly anti-infective. It's being used to treat malaria with good results. It's being used to treat HIV/AIDS with good results. So
Nice.
it's being used to treat bacteria, parasites, and viruses. And my husband was very sick with both of had a lot of symptoms of active babesia as well as Lyme. And I think that's one reason why this drug was so effective, because it's being used effectively to treat malaria, and so it knocked back his babesia, which is very similar to malaria, the parasite, as well as the Lyme infection. So he had, like I said, miraculous recovery after years of different therapies, antibiotic therapies, et cetera, that just he would be okay for a while, but then he would relapse, and over time, like I said, his health deteriorating. I myself also went on the Disulfiram because I was in quote unquote functional remission, but I know that this infection has periods of latency, and I don't consider myself cured. I consider myself to be in remission, meaning I'm not showing symptomology, but I was concerned about the fact that I had gone decades undiagnosed and untreated, and I had clearly central nervous system involvement with this infection. I mean, prior to my initial diagnosis and treatment, I had seizures and tics and tremors and fasciculations and severe, impairments, all kinds of neurological impairments. And I had never done IV antibiotics to get into the central nervous system for treatment, partly because I don't tolerate antibiotics very well. I had done various herbal therapies that are supposed to penetrate into the central nervous system. And like I said, I was doing quite well, but I decided to do Disulfiram as well because I wanted to make sure I was getting infection in my central nervous system addressed. And I had very significant herxing when I went on the drug, far more than my husband did, which just shows that I really did have a lot of latent infection in my body.
You can't really open the body up and kind of measure the infections that's inside of it.
No. And I mean, I was asymptomatic, but I had this infection, and the Disulfiram kicked it up and showed just how much infection was still there, really, as I went through reactions to the treatment, and also overall improvement over time. So even though I was in quote unquote functional remission, for me, taking the Disulfiram resulted in much improved sleep cycles. I had even though I was in functional remission, I always had problems with insomnia and other sleep disturbances. Overall energy improved. But, just the thing that strikes me is that I was in functional remission, and it really showed me I had infection. It really showed me I had infection. Now, my reaction was, I said, much more. I had significant herxing. I had, when we lived I had partial seizures and everything like that coming back. Other neurological things that were quite disturbing. All my POTS symptoms, my postural orthostatic tachycardia symptoms all came back. Now we know, because I was one of the first, my husband and I were part of the early group of patients who were treated with Disulfiram. Now we know that I probably never should have gone to as high a dose as I did. and that, there are certain supplements I could have taken to minimize the herxing
Yes.
that we didn't know about. So I'm kind of part of that group of patients as part of the first early learning curve of the Disulfiram, and I do not regret the experience I had because I still had a very good outcome. And my husband certainly had a fantastic outcome with far fewer side effects. We both developed temporary neuropathy in our feet that resolved after going off the drug. And this is documented to be possible that you can develop temporary neuropathies in your feet and such that in the most cases resolve. In our case, we both resolved. We took lion's mane, though, to help with the resolution of the neuropathy.
Yep.
Lion's mane, which is a mushroom. So what's important to know is that there are now many hundreds of thousands of patients across the globe who are using the drug. And the learning curve is very high in terms of what seems to be working, dosing. There's been a lot of new thinking on what dosing should be. There's been recognition that women tend to be more sensitive to the drug than men for various reasons. We don't know why yet, but so that affects dosing. There's more information on what kind of supplements should be done to minimize herxing and all of these things. And of course, it's not a drug that works for everybody.
Right.
But it seems to be very, very helpful for many, many people. And it's inexpensive, and it's not an IV.
That's cool.
So it doesn't have the cost of managing the treatment like so many of these other therapies do.
How long did the Herxheimer reaction taper for you when you were taking it? Did you notice
Yes. Yeah. So it got less and less over time. Yes.
Okay. And how long were you on Disulfiram for?
Well, I had to take a break after my first big Herxheimer reaction, and then I went back on it. But I was on it twice, each time for a period of about 5.5 weeks with a break in between.
Okay.
And then the last time I was on it, again, the dose, I went up to a fairly high dose for my body. 375 was too high.
Oh.
And I had another reaction that was significant. So I went off of it. But, total time period of 10.5 weeks with a break in between. But, the thing is, this drug has a long half-life. So after you stop taking it, you still have it in your system for another 2 weeks, 14 days. So not too much. So it's definitely been effective in helping my overall health and well-being, and phenomenally effective in helping my husband, who was so sick at the time he started treatment. And, would I take it again if I become symptomatic? Yes, I most definitely would. It has very low risk. It's a 70-year-old drug. I mean, I'm talking generally, in general terms, it's proven to have low risk. But, we're learning more and more about it. So it's very important that the work that's done by Dr. Rajadas and his team out in Stanford be supported. So one of the things I'm doing right now is working with some people to try to get funding for their work, because they are working to improve the drug just a little bit so that's better tolerated by more patients.
Oh, cool.
Yeah.
Kind of redesign the drug or so that it's
modify it a bit, and tear coated, but there's already compounding firms that are making it and compounding companies that are making it in smaller doses so more people can tolerate it. Part of it has to do, I think, with the amount as well. Part of it, I mean, again, I'm not the scientist on this, but I understand there's tweaking that can be done. But the cost of our treatment was basically $1 a pill, so.
That's cheap.
So cheap. And then we had to have regular blood tests done to make sure our liver function was good.
Yeah.
That was not expensive either. That's a standard blood test.
Yeah, when you're on a combination antibiotic therapy, that we get the liver and kidneys tested every 4 to 6 months.
Yeah. Well, this you get tested every 3 weeks.
Oh, wow, that's pretty intense. Yeah, that's an actual study you were involved in, right?
No, no, it's just that disulfiram was originally used to treat alcoholism,
Yeah.
and the drug can cause liver damage, so that's why you want to make sure you get tested.
So, okay, is neuropathy the most common adverse reaction, and what's the worst case scenario for disulfiram? That's the information people.
I don't really know, but I think that I don't know what the worst case scenario is. I do know that that people, if they're herxing and their Lyme history involved some serious symptoms, that can be a very bad experience to have.
Yeah.
Now, I personally, when I was reliving all of my serious symptoms, I personally took that as a good sign because it meant to me that the drug was getting into those places that really needed to be treated.
Yeah.
So I was willing to take the ride, but I was.
People with neuroborreliosis specifically are at risk for experiencing panic attacks and during their Herxheimer reactions, and that could be fairly traumatic, especially if they're not aware of why it's occurring or how to deal with it. Or
I think it's a drug you should have people in your life who know that you're going on the treatment and they're helping you monitor yourself.
Yeah.
Because I do know that at one point my thinking was affected.
Yeah.
As it was getting into my brain and getting into the infection in my brain, my logic was was affected for on and off. Luckily, that period didn't last too long.
Yeah.
But I remember being aware that my logic was strange. For example, I'll give you an example. The color combination of pink and green, I think it looks nice together. But in my brain, I would think pink is green and green is pink.
Oh, I see. Kind of dyslexic a little bit.
Well, it was just a weird way. It's like my logic was disrupted.
Yeah.
That's all. I mean, I was careful to be very verbal about where I was physically and mentally and emotionally as I was going through the treatment.
Wow. Well, that probably helped a lot, though. It helped your husband help you go through that treatment, go through that time.
Yes, and for him as well. It was I had to work with him a little bit to make sure he was communicating with me where he was. Yeah. But it's so important because particularly if you're coming up with old symptoms.
Yeah.
And you've had long-term systemic infection that can affect so many parts of your body. Yeah. You need to be very mindful, and you can't always mind your own mind.
Right.
Particularly if in my case, I had been previously diagnosed with multiple sclerosis. I had a lot of brain lesions, so these lesions are indicative of infection. And that now I had no symptoms of MS when I went on the disulfiram, but clearly I showed a lot of signs that the disulfiram was treating central nervous system infection.
Right. So
and I'm very happy because I think I hopefully delayed the possibility of dementia by getting this treatment.
Yeah, that is definitely something that Lyme patients have to be concerned about.
Yeah, absolutely.
Dr. Alan McDonald specifically has done extensive research in this regard.
Yeah.
Well, it sounds like disulfiram is another tool in the physician's toolkit to help treat Lyme disease. Maybe not.
It's very promising, and it's. I say this because it's not an antibiotic.
Yeah. And
so this whole move for antibiotic stewardship and telling Lyme patients they can't have antibiotics because, they need to be used only for serious illness kind of thing and being denied antibiotics.
Yeah.
Well, so disulfiram opens an opportunity for a broadly anti-infective drug that's not classified as an antibiotic.
Yeah, and just
because may be effective. Excuse me?
Just because you're taking it doesn't mean you're an alcoholic.
Right. Although I do know people who have claimed to be alcoholics so that they can get access to the drug.
Sure.
And whatever it takes, I'm going to tell you, if you are medically marginalized and you need treatment, do whatever it takes to get the treatment you need.
Yeah, that medical marginalization is exactly what we're talking about today.
Right. So, so I was going to say, so it's great because it's not an antibiotic. So it does not, the argument that we're restricting antibiotics and there's stewardship of antibiotics and we can't give it to Lyme patients for these reasons, that argument falls away with disulfiram. And the other thing is because it's not an antibiotic, it doesn't strip your gut.
Yeah.
So you don't have the complications of getting your gut health and immune system affected by like you do with antibiotics.
Yeah, continuous treatment. Yeah. Well, what's next on your plate?
Well, right now, I am enjoying my husband's good health.
That's great. That's
so we're actually having time, to actually just enjoy doing things together, which was very hard to do when he was so sick. And so that's part of what's happening in my personal life, but that's a big change. Yeah. Because when you have a chronically ill partner, so much time and energy goes towards just helping basically support them. Yeah. And so it's really nice to have this lease where we are actually out enjoying life together and activities. But in terms of advocacy work, I'm very much focused on continuing to educate people about the importance of the ICD codes and how they can be used eventually once they're adopted, and prior to their adoption, how they can be used to leverage influence in advocacy work. And the other thing that is of interest to me is to get support for disulfiram, recognition and support for disulfiram as one of the possible treatments for this very devastating illness.
Yeah. So, and to read about that, your fight to get the ICD codes recognized for Lyme disease, people should definitely go to Amazon and pick up a copy of your book. They can get the Kindle version for really affordable, actually.
Yeah, it's just like $3, $3 or $3.50 or something. Yeah.
And it's got these great illustrations by David Skidmore in it.
Fantastic illustrations. Yes.
They're so funny, and they hit hard, really, when you put it into context. There's a link in the description below. Jenna, thank you so much for being with us today. This is a great interview.
Thank you for this opportunity, Jeremy.
Anytime. I definitely want to have you back sometime. And if you guys enjoyed the show, please feel free to leave a comment, hit that like button, hit the subscribe, reach out to Jenna. I'm going to leave some information on how you can get in touch with her, and definitely pick up a copy of her book. Jenna, thank you for your time. It's been fun.
Thank you. Okay, bye.
All right, guys, take care.